little turbinate. Locate where the frontal is, which is following right at the track. If I do the light response, you can see the frontal sinus.
Oh, wow.
Highlight and light up.
See the
That's
light
the
up.
frontal sinus.
Wow. Boy, that's cool.
And so using my camera, I'm going to gently advance the balloon. So as we inflate, you're going to feel some heavy pressure. Ready? Balloon up, down. Balloon up, down. Balloon up and down. Good job.
Yeah, so there's some crunching.
Yeah.
Not as bad as down bottom. What you did.
And we'll do the same thing on the right side. And again, we have the middle turbinate. I call it the stomach because it kind of looks like the esophagus and the stomach that hangs down. And middle turbinate actually connects to the back part of the nose. Right now we can see the palate down here, down below my section. The little cleft here is where the eustachian tube opens when he swallows. Right in this cleft up here at the back part of the nose. That's why when you swallow, you'll feel the pop or the noise, the click that's made when with swallowing. So again, the balloon slides over its guide. So you're going to feel the pressure, balloon up, down, balloon up, down, balloon up, and down. Good job. Excellent.
Feeling.
You're doing amazing.
For the next sinus, they're known as the sphenoids. So I'm going to take my brayer. So you're going to feel me push this out of the way a little bit.
That's the polyp?
Yes. In a little bit, I'm going to come back and relieve it using the instrument called the shaver.
Why am I not feeling blood like draining all down my throat?
Are you feeling it?
No, why am I not? It seems like I would think because it's so vascular up there that it would be.
It can. It's normal that there may be some drainage that's felt or experienced, but typically with the patient alert, there's usually it's drier because you maintain vascular tone.
Rob, can you feel that?
Mm-hmm. Well, just pressure.
Yeah.
So again, gonna feel some pressure in the back here. Balloon up, down, balloon up, down, balloon up, and down. Good job.
Yeah, that one burns.
So we've opened into the sphenoid sinus back here, into the cavity. The sphenoid sinus is on its roof is where the gland in the brain is called the pituitary, and pituitary is the quarterback for the hormones. And again, you're going to feel some pressure here. Might be a little tight. Balloon up, down, balloon up, down, balloon up, and down. Good job.
Yeah, that one burns.
Almost finished sinus-wise. We're going to do the maxillary sinuses in the cheek.
Are you finding the passageways to be narrow?
At first, yes, but as we clear them, it's opened them up pretty nicely. So do you have the maxillary seeker? Andrea's doing great. At lunchtime, I have her hand her my utensils.
You did what?
No, actually, she's great because she knows what often I need. But the maxillary sinus opens behind this flap, kind of where my seeker is going. So if I come underneath here with the ball of my instrument, it will normally seek where the maxillary wants to drain. So what you'll do is conform the instrument for the maxillary. Oh, I'm still with balloon.
Oh,
Still on balloon. You're a step ahead of me.
I'm trying to plug that in.
Have 2 more to do with the balloon, and exactly, I'll be going to that right next. Need a maxillary.
So is there any correlation between hormonal issues and sinuses?
Yes.
Yeah, it must be.
Particularly in women during pregnancy. And what happens is estrogen, when it's high in amounts, will increase blood flow. The reason for it is that if there's a pregnancy, then they'll need a lot more blood flow to the uterus and to the baby. And so tissue that expands with blood flow, like the nose and the turbinates, will also be involved. Going to feel some pressure. Balloon up, down, balloon up, down, balloon up, and down. Good job. So we have 1 more to do as far as sinuses go.
Mm-hmm.
Then we'll reduce down the inferior turbinates. What the turbinates do is that the longest one, the inferior turbinate, will warm and moisturize the air. When you breathe it, the airflow is going to go front to back. And it's got little tiny capillaries or blood vessels that will warm up the air and add some moisture to it. But sometimes, for different reasons, they may take up a lot of space. So what we do is we reduce down their size so that there's more room for the airflow. We used to think at one time, or my predecessors, I guess I should say, felt that if you remove much of the turbinate, it's the best thing to do because it will allow the nose to breathe better. It seems to make sense, but the problem is that if too much is removed, then the nose gets very dry and it can clear its drainage as well. So we like to preserve a good part of the inferior turbinate. Right now we're entering the maxillary. So you're going to feel some pressure here. Balloon up, down, balloon up, down, balloon up, and down. Good job. Now, I want to take the shaver. I'm going to come back here. With my suction, because right there is the polyp. Polyps are interesting. They're I describe them as a blister that forms, and when they form, they form when the nose gets irritated for any reason. Sometimes allergies will do it. So see, it completely cleared that away. Make it disappear. I'm going to take a follow-through look just to make sure there aren't any further, but that was, I think that's what you felt dangling down. That when you would breathe in, sometimes it would get below that point there. There actually is a little one up here.
You want to get that one?
Yeah. Over here. Let's do it. Then we'll get it all nice and clear. I also want to take a look at his middle meatus by the middle turbinate. There we go. Beautiful. That's got him open back to the sphenoid. And I want to take a look on the inside of here. Got one right there that just want to see what it's. It's part of the incident, but I think I can smooth that front part. It's different for polyps in the nose versus the internal structures like the GI tract or the colon. They're more glandular and but in the nose they're typically they're not precancerous or as concerning. I want to kind of keep most of the front of that intact because that's a sinus opening known as the ethmoid.
The what?
Oh, it's the ethmoid sinus.
Ethmoid.
The ethmoid sinuses kind of form the root of the nose. And they're typically up through here. They start at the ethmoid bulla and they run back along the roof of the nose. I'll take some more local. And what I'm going to do is put some additional Novocaine in the inferior turbinates.
We
And
gonna
then-
need some more than that, Dr. Isberg? I can run and get some.
I think we're good.
Okay.
Usually at the very front here, I'll try to shave these down a little bit. And that, thinking will give some more room for the breathing.
And those are called turbines too, or no?
Turbinates, they sure are.
Turbinates, yep. So all those little things in there are called turbinates.
These are the part here where my needle's resting is the septum.
Okay.
It's a cartilage wall between both sides of his nose.
Mm-hmm.
So what I do here is I use my sickle. I could make a little tiny incision. You may feel kind of a scraping feeling. And I'll take the caudal. What I'm doing is the lining's kind of like a thin skin. So I kind of come underneath. There's kind of a sort of hollow bone that is underneath. So I lift the skin. I like to preserve the skin because there's less raw surface, less scalp that occurs. And then again, the instrument with the shaver has a rotating blade. So what I do is I, with the blade side toward the bone, kind of come underneath my tunnel. And adjust the speed just a little different. Kind of do it in a series rather than all at once so it doesn't create friction or a hot spot. as it heals, it will shrink. And I'll take the sponges to kind of dry them up a little bit. Because the tissue will contract and then it will shrink down. So I'll put some of my Afrin sponges here.
Surprised I can breathe so well during with all
surprised.
this
You're
stuff up in my
doing great.
nose.
Exactly. At the very end, I'll put some dissolving material in. It will be kind of stuffy a few days, but then as you use your spray, it will tend to dissolve rather than have to be removed.
So that has numbing agents on it.
It does.
Yeah.
It has Novocaine or lidocaine. Plus, it's got a little Afrin on it too. Afrin decongest, it kind of constricts blood vessels too. So I'll need the sickle here in a little bit. It's interesting with the nose is that we're operating internally using a fiber optic camera on our scope. In our specialty too, we operate on the ear. That's usually under a microscope through the ear canal. And then third area we operate on is the vocal cords. So usually that's with the microscope too, and that's way distant. That's probably at least a foot down from the mouth where we have access down to the vocal cords.
I got some drainage going on.
Absolutely. It's okay to swallow it, and I'll try to suction it out a little bit too. You can see how it kind of shrinks up. And I'd like to get a nice dimple in it.
And again, that's just for more space, right? You're just,
Exactly.
like a liposuction.
Exactly. Have you ever heard of, I'll take the sponges, Andrea. Ever heard of Bernoulli's principle? Interesting thing with Bernoulli's principle is that if you inhale through the nose, might even have them do it here, sniff in as hard as you can. And real hard. Real hard as that. See how it kind of narrows in? So, because of Bernoulli's principle, if we get even as little as 1 millimeter of increased space, it opens his nose by 30% more. Just with 1 millimeter. And a lot of times, one of the things you could have students do is just to rest their finger right here along the crease between the nostril and the upper part of the nose. And just resting the finger there, they'll notice that the nose doesn't breathe as well. With breathe right strips, the breathe right strips will normally spring this open to allow better breathing. But internally what we did is we brought down the volume of the inferior turbinate, which runs from the front of the nose to the pharynx of the throat, and gave him more room to breathe. Often the one of the misunderstandings that people have, especially if they go to put a feeding tube in, is that they'll naturally assume that the nose goes up this way, but it doesn't, it goes straight down. So a lot of times you'll see new nurses or physicians trying to bring a feeding tube up this way, and they'll just basically hit the roof and won't be able to pass it. If the direction is toward the ear on a plane like that, then inserting a feeding tube will naturally follow the course of the nose, and then right about in here it will make the curve down to the throat.
Interesting. Wow.
Now, there was a conference I went to in Las Vegas, and one of the science professors at UC Davis got a call from the zoo. And he thought it was a prank by one of his resident classmates because they said it was the veterinarian, and he thinks his gorilla has sinusitis or chronic sinusitis. So actually, he did. The gorilla had pus or infection draining from the nose. So the next challenge was how to get a CT scan on a gorilla because they had to sedate the gorilla and run the gorilla through. I forgot how they did, but they had to run through a CT scan. And then it did show that there was an abscess involving the sinuses. So then they had to do surgery on the gorilla. And the instrument companies, if they use it for any animal, they can't reuse it on humans. So the companies were willing to donate the equipment. What they did later is they didn't use it on the live human, but they used it for their cadaver lab because that's basically how we train with people that donate their bodies to science. We use the cadaver to identify our landmarks and practice our surgery. Big advantages, cadavers don't bleed. But
I got to help my dad with a bunch of those. My dad's an orthopedist, retired.
Oh, excellent.
So,
they do that over. The anesthesiologist said we have to stop and wake him up because, he's going through renal insufficiency. Take silver nitrate. I normally paint the surface with silver nitrate. It cauterizes that area. And then at the very end point here, I'm going to put a few pieces of what I scientifically call the purple stuff. It has an ingredient from shellfish that stops bleeding. Yeah, so do you teach at the high school level?
Me? Not at, I teach middle school. I teach everything. I do a lot of different things, but I work with research students as well.
Excellent.
I have taught a high school students, but right now I'm specifically with middle, like literally right now. Last week I was with a bunch of high school, 4 through 12.
The thing I really liked about science is that you could actually see as an apprentice as well as read, because I had a mild form of dyslexia. I think the silver nitrate that made reading difficult, because what would happen is the brain uses the ears and the temporal lobe to make sense out of words, just like it makes sense out of sounds. And it's hard to imagine with dyslexia, but as you read for a while, the words scramble together where they don't make sense. And just like with hearing impairment, the words are not clear, and so it doesn't make sense what the person's saying. But because of that, reading was a struggle and pretty complicated.